Trifecta on PJTV. I'm Washington Examiner columnist and ScrappleFace.com editor-in-chief Scott Ott. You know, all eyes have been on the public option provision of the Healthcare Reform Act, and this is certainly a major threat to our way of life. However, we need to look at what the president says he'll do to the private health insurance industry, even if, as we've heard in recent days, he may not get the public option through Congress in September. The threat of his promised regulation of private insurers is perhaps greater. By accomplishing this, he may wind up getting the public option after all, along with plausible deniability because the public will beg him for it. In his Sunday column in the New York Times, Mr. Obama tried to make the case for health care reform by summarizing his recent 8-point plan that used to be a 3-point plan into 4 simple points. At the heart of his argument was the idea that health care companies are run by greedy people whose primary goals are 1, to deny coverage, 2, to reduce the size of their customer base, and 3, to increase the number of customers that declare bankruptcy due to unreimbursed medical expenses. Bill Whittle of eject.com and PJTV. Do elected officials and government workers come from more virtuous stock than the nefarious capitalists who run private companies? If they don't, why does the president think a government-run plan would help keep your insurance company honest?
Well, government workers, as you know, Scott, are bred in large hydroponic tanks located deep below Washington, D.C. They're fed a diet of honey and alfalfa. No meat products of any kind introduced in there. That gives them the superior moral halo that allows them to make the kind of decisions that you and I can only dream of. But, you know, you bring up an interesting point. The president says that the problem with health care is these corrupt, greedy insurance companies. And the problem with the automobile industry is these corrupt, greedy automobile executives. And the problem with the finance sector is these corrupt, greedy financial guys. And the problem with any sector you want to point to is these corrupt, greedy businessmen. It's never the government. It's never the regulations. It's always businessmen. And you point out, he's basically saying, yes, we want to create a business that reduces the number of customers, reduces their satisfaction, drives them into bankruptcy. He thinks doctors make more money, that they're motivated by amputating legs or taking out tonsils. He said both of these things. The fundamental truth is the guy has no idea about any kind of business at all because he's never had to run one. Those of us who've been paying attention to Barack Obama's history could have told you this before November, but it seems that more and more people are slowly waking up to this fact.
Steve Green from vodkapundit.com and our correspondent from Colorado, where it's, like 12 degrees out there all year round. The president seems to be maybe dialing back the urgency on the public option. Now, I thought this whole thing was about the public option. And so if that's not the heart of the president's plan, he actually said it was a sliver, which I believe you can now get removed for free in any emergency room in the country. But he said it was just a sliver of the plan. What is the plan anyway, or whose plan is it anyway?
Well, you know, I actually I had a thought while you were talking earlier, and I can't remember the exact quote, but it came from Lenin. And Lenin's idea was during the First World War that before he could take over, he would have to make things worse in Russia. And of course, Rahm Emanuel said you should never let a good crisis go to waste. And these are really, strategically anyway, 2 birds of a feather. You've been talking about kind of the strategy involved here, and Bill's been talking about the more philosophical angle. I like to talk about the tactics here, and I think they're flawed. If we're going to beat this thing, I think it's because of these stupid tactics he's using. And that is, if you ask people who are insured, about 80% of Americans, do you like your plan? Most Americans say, yes, I am happy with my plan. Where Americans aren't satisfied is that, you know, that 47 million who aren't insured, although a lot of them are either illegal or young and healthy and don't want to waste money on insurance, that kind of thing. So if the president were to talk about restructuring the social safety net in such a way to get more people covered or to pay for them in better ways than just letting them wait till it was time to go to the emergency room, I think he could get a lot more support. But the way he's doing it, he is scaring people, and it's bad tactics, and I don't think it's going to work. At least I hope not.
Thank you. And by the way, I really like the way you say Rahm Emanuel. I'm reminded by my theological training that Emmanuel means God with us. I'm not going to take that any further.
Well, now.
Bill Whittle.
Learn something horrible every day.
President Obama says in his column in the Sunday New York Times that one of the great ways we're going to save money with the healthcare reform is by squeezing out hundreds of billions of dollars in savings from Medicaid and Medicare, which are, oh, by the way, the health insurance programs that the government runs now. Now, frankly, I can't even formulate a question without dripping vitriol onto my good necktie. So just Can you take that for me?
Yeah, I'd love to. We'll get you a little paper bib. You know,
Thank you.
the problem with having an ideology that's at fundamental odds with reality and facts is that sooner or later the narrative comes and eats its own tail. It's like a snake that comes all the way around, and you're confronted with the ridiculousness of all of it. It's like when President Obama was making the case for the public option. He said, FedEx and UPS are doing fine. The post office is in real trouble, though. Comes a point when you have to come off the cuff with an example, you realize you're dealing with reality, and there it is. The public option means that you don't have to compete. These people don't sell hamburgers less than we do. They can pay you to come in and have a hamburger. That's what the government does. And every time the government gets involved with something, the waste and the inefficiency increases. And you can make the same argument with Amtrak. Amtrak's a government subsidized, heavily subsidized program. If the president's model is correct, the presence of Amtrak should have spurred massive numbers of competitive private railroads, but it put them all out of business. It continues to hemorrhage money at an amazing rate. It's losing riders because the service is terrible. And you can just find example after example after example. The only way they can win this game is by not referencing the real world. So, Mr. President, don't mention anything in the real world from now on. Keep it on hope and change and hope for the best.
Well, now, speaking of Steve Green, speaking of real world, you know, am I being a bit too clever in thinking that it's possible that what the president's doing here is saying, hey, you know, the public option's not that important, but then he's going to regulate the tar out of the private industry to the point where nobody can make money selling health insurance, and we will beg him then for the public option, and he'll look great because he went along with our view, and then he bailed us out when our stupidity got us in trouble.
Yeah, I call it creating the crisis that they won't want to put away, so I'll try and keep this short. You've got these folks in Washington who want a takeover. The problem is they don't really have an excuse, and they are trying to create that excuse. They're trying to create that crisis. That's what we've got to be careful of, and that's what we've got to call them on time and time and time again if we're going to beat this thing.
Bill Whittle, what we have is a failure to understand the fundamentals of economics. You have 30 seconds to rant.
Yes, he does fail to understand the fundamentals of economics. I heard David Frum talking to Bill Moyers over the weekend on TV, and they basically said, Moyers said, well, you conservatives like competition. You should want a public option because it increases competition among the private insurers. Private insurers compete against other people who can compete. As I said before, if you're lowering the price of hamburgers, that's one thing. If you're competing with a store that pays people to come in and eat your hamburgers, you cannot compete.
Steve Green, your 30 seconds.
I'm going to stick to my 30 seconds. I'll tell you what, that's vicious. The only other example we really have of a single-payer system is the Defense Department, which is the only company in town that buys bombs and airplanes, and that has been an expensive mess filled with fraud since World War II when Senator Harry Truman tried to shut it down. Nothing can fix it, and that's the direction they want to take healthcare in.
Steve Green from vodkapundit.com. And you know, it's fundamentally failing to understand economics means you don't realize that in a capitalist system, there's a virtuous cycle spurred by people's self-interest that says, I want to do good for you so that I can benefit from it. President Obama, wake up and read The Wealth of Nations by Adam Smith. For Trifecta and PJTV.com, I'm Scott Ott.